Yeah, so David, I was very inspired to learn that you spent time in the Amazon rainforest. So can you tell us what inspired you to do that and what you learned from it?
Yeah, so I was working there as a physician in the Amazon for the past year. This is a requirement that we are supposed to do after we finish med school. We have to work in a rural village in Ecuador for a year. And I was placed in the Amazon rainforest in a community called Guayusa, which is 30 minutes from the closest city, which is the Coca. During my time here, I think that I learned what is privilege, because there is a huge lack of access to services in these places. And it's very sad because I think that the Amazon region is the richest one in Ecuador in terms of natural resources, especially because of oil. But at the same time, is where I have seen the most poverty and inequality in the country.
Right.
There are a lot of issues in the region. For example, one is gender norms. I had a patient she was 16 years old, and she was using a hormonal implant as a contraceptive method. And she came to the clinic because she wanted it to be removed. And I asked her if she had any kind of issue, if she had any kind of side effect or a medical condition for it to be removed. And she said, no, I just want it removed because I want to become a mother and it's time for me to become one, because women are supposed to be mothers. And I was really surprised by that answer, and I asked her if she had finished high school. She said no. I asked her if she had any kind of source of income. She said no. So I wondered how she was planning to support her pregnancy and her future child. And she said that her husband was supposed to take care of that because he's the man, of course. And this is strongly related with big issues in the country. For example, child marriage, even though it is against the law, in the community level it is not enforced. And also related to adolescent pregnancy and indefinite pregnancy, which is also a medical issue for sure, due to the health-related complications, but also social issue, definitely.
Yeah, right. And what are the living conditions like in the Amazon?
In the Amazon,
where you were?
Where I was working, the lack of services in terms of health is one of the major issues. For example, I had people in communities who were part of like my geographical reach of the health center where I was working, that were as far as 5 hours by boat through the river. So for these people to access these health services, basic health services, was a challenge. And even for example, let's say that I have a case that was complicated and I had to refer to the hospital, people were not like, I'm not going there because it's too far from my home, and I will not be able to pay to go back after I receive health care.
Oh, wow.
So these kind of issues are real. There are also, for example, cultural norms that are deeply rooted in their minds, and some of them are dangerous.
Right.
For example, another case that was interesting is that the shaman of the community had this treatment for children when they were sick. That was the diet that they called, and the diet consisted in not eating for a week.
Oh,
so
gosh.
I had like 1-year-old kids who were on this kind of diets, and then when they go to the health center, they were like in very bad conditions, almost like critical.
Right.
Because yeah, I mean, imagine not eating for a week.
I know, right.
So these kind of issues are deeply are an issue for sure, because I think that they affect the most vulnerable ones, who are kids and children and adolescents.
Yeah, and what about toilets and sanitation and hygiene in that region?
Yeah, it's of course also an issue. I mean, the health center had a toilet.
But in the homes, they don't have toilets.
No,
most
in
homes.
general,
no.
no.
Okay, well, thank you very much. It's interesting to learn about what you did, and that's really an amazing impact that you made, I'm sure.
Thank you so much.